Hello, dear students. My full name is Nabiba Diora Mirhamzayevna. I am assistant of the first pediatrics and neonatology department. So today's your topic is acute renal failure and chronic kidney disease in children. So acute renal failure in children is a sudden and often reversible kidney dysfunction leading to a buildup of waste products and electrolyte imbalances in the body. The etiology of acute renal failure, ARF, in children can be diverse and may include dehydration, insufficient fluid intake, or excessive fluid loss due to vomiting, diarrhea, or fever can lead to ARF. The second one is infections, severe bacterial or viral infections such as sepsis or certain types of nephritis can damage the kidneys and cause ARF. Urinary tract obstructions, blockage in the urinary tract, such as kidney stones or congenital abnormalities, can impair kidney function. So, kidney injury, for example, trauma, toxins, medications, or certain medical procedures can cause direct damage to the kidneys and result in acute renal failure. So, hemodynamic changes, circulatory shock, hypotension, or other conditions affecting blood flow to the kidneys can lead to acute renal failure. The sixth one is systemic disease. Conditions like systemic lupus erythematosus or hemolytic uremic syndrome can affect kidney functional and lead to ARF. So, seventh is genetic disorders. Certain genetic conditions, such as congenital nephrotic syndrome, can predispose children to renal failure. Medications, also, certain medications, especially those that are nephrotoxic, can cause kidney damage and result in renal failure, acute renal failure. Other factors is conditions like autoimmune disease and certain metabolic disorders can also contribute to acute renal failure in children. So pathogenesis can be classified as prerenal failure, intrarenal failure, or postrenal failure. Can be reversible, can lead to chronic renal failure caused by obstruction, poor circulation, or kidney disease. Interruption in flow can lead to serious failure. So, acute kidney failure in children may present with following signs and symptoms: decreased urine output or no urine output, swelling in the face, legs, or abdomen, fatigue and weakness, nausea and vomiting, high blood pressure, decreased appetite, pale skin, shortness of breath, confusion or altered mental status, and seizures. In this picture, revealed clinical features and physical examination. So, and in this picture, revealed a diagnosis, for example, blood, urine, imaging, investigations, and findings. So, urinary insights, summary of differences in values, urinary natrium, prerenal, intrarenal, and postrenal. So, management acute renal failure, hospitalizate in the child, counsel parents about illness and its consequences, introduce catheter when suspected obstruction, discontinue nephrotoxic drugs, monitor urine output, maintain nutrition. So, fluid resuscitation. If dehydration, normal saline 20 milliliter on kilogram and 2 times. Avoid and manage fluid overload. Diuretics. When adequate circulatory volume, establish furosemide 2 or 4 milligram on kilogram. Dose intravenous, maximum 200 milligram. If myoglobin, hemoglobin induce acute renal failure, mannitol, infusia mannitol, 0.5 gram on kilogram. Peritoneal dialysis maintain associated conditions, for example, dyselectrolytes, convulsion, anemia. Fifth is management of hypertension. And last one is treatment of underlying cause to avoid further renal injury. So the next slide is supportive of acute renal failure. Hyperkalemia, kali restriction, 10% calcigluconate, sodium bicarbonate, regular insulin, and hyponatremia, no sodium infusion or intake, fluid restriction in the primary mode. If natri less than 120, so seizures or other symptoms need to be treated. Hyperphosphatemia, give low phosphorus diet, phosphorus binding protein, calcium carbonate, calcium oxalate will improve hypocalcemia. Hypocalcemia, calcium gluconate 1 or 2 milliliter on kilogram dose should not give until tetany developed. So metabolic acidosis, if there is metabolic acidosis, sodium bicarbonate, anemia, if there is anemia, blood transfusion, if hemoglobin less than 6 gram. So seizures, if there is seizures, diazepam 0.5 milligram on kilogram will necessary. So, chronic kidney disease. Chronic kidney disease is a gradual loss of kidney function over a period of time. It is defined as renal injury, proteinuria, and chronic kidney disease can get worse over time, and eventually the kidneys may stop working altogether, but this is uncommon. Many people with chronic kidney disease are able to live long lives with the condition. So the etiology of chronic kidney disease in children can be diverse and may include congenital abnormalities, defects present at birth affecting the kidneys, such as renal dysplasia or polycystic kidney disease. So genetic disorders, glomerular disease conditions affect the glomeruli, such as nephrotic syndrome or glomerulonephritis. So systemic disease conditions like lupus, diabetes, or sickle cell disease that can affect the kidneys. And the next is infections. So severe or recurrent infections, especially if they involve the kidneys, and the toxic exposure to the certain medications, chemicals, or toxins that can damage the kidneys over time. Chronic kidney disease in children can present with various symptoms, including poor growth, delayed growth, or failure of thrift, edema, swelling, particularly around the eyes, ankles, and abdomen, hypertension, high blood pressure, fatigue, general tiredness and weaknesses, changes in urination, excessive urination, especially at night, or decreased urine output. So, diagnosing chronic kidney disease in children involves several steps, which including medical history and physical examination, information about the child's symptoms, medical history, family history of kidney disease, and any risk factors. Laboratory tests, blood tests, measurements of serum creatinine, blood urea, nitrogen, electrolytes, sodium, potassium, calcium, and markers of kidney function. estimated glomerular filtration, and urine tests also urinalysis to check for proteinuria, protein in the urine, hematuria, blood in the urine, and specific gravity. So, imaging studies, ultrasound, a renal ultrasound may be performed to visualize the size structure of the kidneys. This can help identifying any anatomical abnormalities, signs on kidney damage. Other imaging, in some cases, additional imaging studies such as computer tomography, scan, MRI may be ordered to provide more detailed information about the kidneys and urinary tract. Kidney biopsy, genetic testing. The combination of this diagnostic test helps healthcare providers evaluate kidney function, determine the underlying cause of chronic disease, assess the severity of the condition, and develop an appropriate treatment plan tailored to the child's needs. Chronic renal failure refers to the advanced stage of kidney disease where children's kidneys have lost their ability to function effectively over time. Here are some key points specific to chronic renal failure in pediatric patients. Etiology. The causes of chronic renal failure in children can differ from those in adults. Common cause in pediatric patients include congenital anomalies of the kidney and urinary tract. Hereditary conditions such as polycystic kidney disease, glomerulonephritis, renal dysplasia, obstructive uropathy, and certain genetic disorders. Symptoms and signs. Children with chronic renal failure may present with symptoms such as poor growth or failure to shrink, delayed development, fatigue, weakness, poor appetite, nausea, vomiting, and changes in urination patterns. Physical examination may reveal signs such as hypertension, edema, and abnormalities in growth parameters. So, pediatric considerations. Management of chronic renal failure in children requires consideration of growth and development nutrition. Nutrition needs physiological support and transition to adult care. Pediatric nephrologists often work closely with multidisciplinary teams, including pediatric dietitians, social workers, and child physiologists to provide comprehensive care. So, prognosis of this disease, the prognosis for pediatric patients with chronic renal failure varies depending on factors such as underlying cause, the severity of kidney damage, comorbidities, and access to specialized medical care, early detection, timely intervention, and adherence to treatment plans can improve outcomes and quality of life for children with chronic renal failure. So, in some cases, kidney transplantation may be necessary for long-term survival. So, it is the end of your topic. Thank you for your attention.